Hi, my name is Dr. Chad Watkins with Watkins Foot and Ankle Clinic in Leesburg, Florida. And today I wanted to talk about corns and calluses. So here's a good example of a bone which is prominent and has been rubbing on the shoes. And because of the rubbing, you can see that the skin is red and irritated. Now, if it went further, basically what would happen is you'd start to get a corn or a callus over the area of the bony prominence. So the underlying cause of the corns and calluses is usually bony prominences and rubbing or irritation. And you can get a corn on the side of the fifth toe or the top of the second or third toe. Sometimes you'll get it on the side of the fifth metatarsal bone, or you'll get some callus on the bottom of the foot. So when you have hyperkeratotic or thick tissue present on the toes, that's called a corn. When it's on the bottom of the foot, it's called a callus. So here we have some examples in the brochure of a corn on the side of the fifth toe and some callus down around the heel. And so what we usually recommend to treat corns and calluses is you soak your feet twice a day in water to get it nice and soft, and then you rough it up with an emery board or a pumice stone in order to remove the thick dead skin. But after you've roughed it up, usually people will do this at night before they go to bed, you then want to apply a cream or an ointment, and one that I really believe works well is called Callex. And so you can apply Callex to your heel, and then you can apply some occlusion like a sock or something over the foot. Now another product that's really good is called Heel Balm by Flexitol, but like I said, I tend to prefer Callex, but there are other ones that you can do as well. Carousel. Sometimes you can try lotions for the hand like Eucerin or Vaseline Intensive Care, but those are really good for the hand and dry skin. They don't tend to work as well when you're dealing with cracking, peeling, flaking skin down around the heels. Usually you need a much thicker type of an ointment for that area, and that's where Callex or the heel balm come into play. Now the old home remedy was people would put on Crisco and wrap it with saran wrap. I don't recommend doing that because the saran wrap can get too tight, cut off circulation, things of that nature. So what I usually recommend is just use a sock at night. The other treatment for corns and calluses is good cushiony padding, wider, deeper shoes. You want to take the pressure away from the bony prominence or the prominent area. And sometimes it will need surgery if it keeps coming back over and over again. But usually you just try some nice, good, conservative treatment, and then you can avoid surgery. But if you needed surgery, it certainly is there. So if you're having any problems with corns or calluses, give us a call at Watkins Foot and Ankle Clinic in Leesburg, Florida. Our phone number is 352-805-4317. Thank you very much. Bye.